Well, if you suffer from varicose veins, you know exactly how uncomfortable they make you feel, both physically and emotionally. The treatments that have been offered for years, such as vein stripping, are rather gruesome, and so maybe you've decided just to hide your pretty legs behind a pair of pants instead. Well, good news, ladies. I am here with General Vascular Surgeon Dr. Bassam Sayegh, Margaret Primaldi, nurse practitioner, and the lovely Mrs. Eleanor Oker, a patient of a new treatment for varicose veins called VNUS closure, which is minimally invasive and can have you on your feet, confident and pain-free the very next day. Ladies and gentlemen, thank you so much for being here with me. And you know, Dr. Sayegh, here's the interesting thing. I think a lot of people just have some basic questions. What are varicose veins? What are the treatments? Is it inherited?
Okay. Varicose veins are veins that became swollen because of the blood backing up inside them, and that backed up blood caused them to bulge, give the patient pain because of the increased venous pressure, and at a later stage can cause skin breaks and what we call ulcers of the ankle, that it might end up to be an infection in the bone. It could be inherited. Other reasons for it could be a long-standing position we assume during the day in certain professions. Pregnancy sometimes can speed up their appearance in women.
Yes, and you know, that's what happened to me during pregnancy, is when I got my one and only varicose vein, and I was just a little bit embarrassed about having anything done about it because I felt like it's just a cosmetic thing, I can live with it. But one of the things that we all were talking about is that women do it for cosmetic reasons, but at the same time there could be some medical necessities for doing it as well. Let's talk about the cosmetic. And women who come to you, what do they say and how do you help them?
Well, that's the unique aspect about our practice, that my role as a nurse practitioner, I can address the aesthetic concerns of the patient. They can go and show me what areas are more concerning for them. We can use a mirror or a camera, and then I can get a one-on-one and decide what different options we have for them. And
I know, Eleanor, with you, it really was a medical concern, not a cosmetic concern. Yes. Talk to me a little bit about that. You were having a lot of pain?
I did have pain, especially at night when I went to bed. And then I went to see Dr. Sayegh, and he explained to me what this procedure was like, and made me very comfortable. And it was quick, and it was not painful at all. And I drove myself to the office. I drove myself home. So the next day, it was like I had nothing done with my leg.
Wow.
So I was very happy.
What treatment did you use, Dr. Sayegh?
The treatment we use now is a catheter-based treatment. One of them is called VNUS closure catheter, which is very good, uses radio frequency in what we call getting rid of those veins by ablating it. And it's very painless treatment, very quick, very satisfactory. You get permanent results as far as getting rid of the veins. And also you can see results within 6 to 8 weeks that will make you very happy.
You know, I think there's probably a lot of fear because of what we talked about, the initial stripping procedure that was done before. Eleanor, what kind of advice would you give to women who might be hesitant about having this done?
They should not hesitate to do it because the results are wonderful, and they just shouldn't wait even. That way they can put their slacks and their blue jeans back in the closet. Absolutely.
Well, Dr. Sayegh, if people want more information about the VNUS closure system, where can they find that?
I would think the best place would be the VNUS site on the internet. It's VNUS.com. And that's a very nice site that will give them a very comprehensive view of the procedure.
Well, thank you so much, Eleanor, Dr. Sayegh, Margaret. We appreciate you being with us this morning.
Thank you.
Thank you.
And coming up next on The Balancing Act, do you have a mechanic in your glove box? If not, you should. More on that up next.